All right, let's get right into it. Today, we are cracking the code on a really critical part of the Certified Professional Biller exam. If you're studying for the CPB, you already know the stakes are high. So let's dive into a strategic preview of how to think your way to success, not just memorize.
It sounds so simple, right? But everything, absolutely everything, hinges on this one fact. Every service, every procedure, every little supply has to get translated into a specific code before a claim can even begin its journey.
And this is where it gets really important. The right code, that means the right payment. But the wrong code, oh, that leads to denials, frustrating delays, and it can just break the whole revenue cycle. This is so much more than data entry. It's about the financial health of the entire system.
So, the big question is, how do you get fluent in this language? Well, that's exactly what the CPB exam is designed to test. Today, we're going to give you a special peek inside the exam coach's framework to show you exactly how we train you to master these systems that drive reimbursement.
First off, let's tackle the why. Why do so many smart, dedicated candidates get stuck on certain parts of the CPB exam? Well, it almost always boils down to a few common, frustrating sticking points.
Does any of this hit a little too close to home? Maybe you're a whiz at looking up codes, but you freeze when you have to decide which system to even search in. Or maybe you've got dozens of codes memorized, but you're just not sure how that connects to a claim actually getting paid. This is the exact wall so many students hit.
And that right there, that's the heart of it. The exam isn't trying to test your memory. It's a logic test. It wants to see if you can actually think like a biller, and if you understand how these coding systems have to work together to tell the full financial story of a patient encounter.
Okay, so how do you make that jump from just memorizing to really, truly understanding? Well, you need a framework, a structured way to think about the problem.
So, let's pull back the curtain and show you the structured method we teach from our official guide. Now, we're not going to give you the whole lesson today, but what we are going to do is show you the system for thinking your way through these challenges. Let's see how this all builds out, starting with the first huge pillar in the world of coding, CPT codes.
Okay, CPT. Here's the key. It's all about what was done. It's the language we use to describe all the medical, surgical, and diagnostic services and procedures that doctors and other providers perform.
You see, CPT isn't just some long list of codes. No, it's a powerful tool. It standardizes documentation, it justifies the claim, and, it has a direct line to what patients and insurance companies end up paying. It's a huge deal. Really think about that for a second. How does the specific hands-on work a doctor does with a patient get turned into a universal code that some payer, maybe hundreds of miles away, can understand and then pay for? The whole magic trick is in the CPT system. But a procedure is only one part of the story, right? What about all the other stuff? That brings us to the second pillar of our framework, HCPCS Level 2. So, if CPT is all about what was done, then HCPCS Level 2 is about what was used. This system is designed to pick up right where CPT leaves off. This is where we find the codes for things like medical supplies, everything from crutches to bandages. It also covers things like ambulance rides and other services that aren't actually physician procedures. And it is absolutely critical for billing payers like Medicare. So here's the kind of strategic question the exam needs you to answer. At what point does the story switch from one coding system to the other? Knowing where that line is, that is the key to preventing claim denials. Okay, this is where the framework really comes to life. We stop looking at CPT and HCPCS as two separate things to memorize and start seeing them as one beautiful, integrated system. Look at this. It lays it out so clearly. On the left, CPT is about the action, the procedure the doctor performed. On the right, HCPCS is about the item, the supplies, the equipment. It really is as simple as what was done versus what was used. Let's test this out. Real quick scenario. The surgery is the action. The wheelchair is the item. So, based on the logic we just laid out, would you use the same coding system for both? Answering that question correctly, that's the kind of system thinking that separates a passing score from a failing one. So let's just nail this down. The entire universe of what the physician actually does, yup, that's CPT. And everything that was used for that patient, the supplies, the equipment, that's all HCPCS. And it's only when you see them as two essential halves of the same story that you can really, truly speak the language of reimbursement. They don't compete with each other.
They complete each other. So, let's bring this all together. What is the real advantage of learning this way? It's actually pretty simple. We are laser-focused on training your logic, not just testing your memory.
Look, anybody can look up a definition in a book, but a certified professional biller, you have to understand the logic behind why you'd pick one code or even an entire coding system over another.
We train you to see the big picture, the entire interconnected system, and we train you to think like a strategist so you can build clean claims that get paid the first time.
Because at the end of the day, that is the ultimate goal, isn't it? It's not just to pass a test, it's to become a professional who truly gets how this critical job keeps the entire healthcare industry running. That's what this certification is all about.
We've really only just scratched the surface today, just to show you the structure and the thought process. The full, in-depth framework that will build your confidence and your competence, well, that's waiting for you inside.